Hello class and welcome to NAS 1100. Today we're going to do probably one of the most important lectures, and that lecture is on suffixes. But I'm not concerned about all the suffixes. I'm just interested in showing you certain patterns that I've seen over the years to cause students problems. Our themes for today will be looking at the double R suffixes, what I'm calling the Tomei brothers. Pay attention to what that is. Record or record, instrument, process. What do we mean by that? Opposites. What's that all about? When memorizing suffixes, it's an approach. And also, make it an adjective. Quick, few slides, just to point out some important information to you. First of all, the 4 double R's. In healthcare, we have suffixes that begin with double R. That's not very common in non-medical terminology or in the world of non-medical terminology, but it's something you want to pay attention to. For example, RRHAPHY, kind of a strange suffix. It means suture. RRHEX, rhexis, it means rupture. We've seen diarrhea, hemorrhage, ruptures. These suffixes all begin with double R's, and we group them together because we want you to really pay attention to them and try to study them that way and not mess them up when you see them at the end of words. What else? The Tomei brothers. One of my colleagues said a student went through an entire medical terminology class and didn't know the difference between an ostomy and an ectomy. That's an awful thing. We don't want you to be like that. So we're talking about the Tomei brothers. All of these suffixes are based on tome, which basically is an instrument used to cut. So if you have a Tomei, that's an incision. So if you have an ostomy, like a colostomy bag, take a look at the OS in ostomy, colostomy. The Latin word os means mouth. So an ostomy means that you're not just forming an incision, you're actually forming a wider opening. Please keep that difference in mind. Then you have ectomy, which means an excision or a removal. You can see the EC here for ek, remove. Don't let these confuse you. Ostomy, mouth, opening. Ectomy, excision. Tomei, incision. Tome, to cut. Other suffixes that give students trouble. I call it record, instrument, process. Take a look at this table right here. And take a look at these suffixes. A graphy is the process of writing. A scopy is the process of scoping. The instrument used to graph something is called a graph. The instrument used to look inside something is the scope. Now, the process of recording here is called graphy, but the record that you produce when you recorded something is called a gram. Very commonly, we see that students get confused with these three. Don't let yourself be one of those. Keep that in mind. Graph, scope. Graphy, scopy. Pay attention to these. Now, when I was a child, there was a TV program that talked about opposites. An interesting way of studying suffixes, studying all of medical terminology, is to look at that thing and its opposite. Socrates said the truly wise are those that know what a thing is and what it is not. So when you study suffixes, an interesting way is by looking at their opposites. So what do I have here? If something's large, megaly, cardiomegaly, the heart is getting larger. What's the opposite of large? It would be something that's small. So ickle, ooh. So a arteriole is a small artery, and then ule is a small vein. So opposites are important. Then look here, something's Soft, we say it's a malacia. But what's the opposite of soft? Hard. Sclerosis means the process of hardening. Take a look here. When it comes to a bone, we could break it. Osteoclasts, we break the bone to fix it sometimes. But what if we bind it, join it, fix it? The opposite of breaking it is adhesis. But if I am binding, fixing an organ, we call it apexy. Keep those opposites in mind. Look here. Narrowing is a stenosis, but what's a widening? An ectasis. So I might ask you what the opposite is of that thing. Take a look here. If I have a deficiency, I call it apenia. If I have too little red blood cells, I call it an erythropenia. But if I have too much of something, too much growth, for example, it's called aplasia. If you have increase or formation of something, it's also called a genesis. And we'll get more into the differences between a penia and an increase in later discussions. Lastly, in our quick discussion, are all these suffixes that if you add them to the end of a root, it just changes the root into an adjective. So if I add ak, al, ar, ari, eel, ik, eor, os, tik to the end of a suffix, it makes it just an adjective. So, which one do you use? Well, you don't use one. You look it up in a medical dictionary and it's there. So if you see it at the end of a word, you know it just means that it's the adjective form of that word for the most part. The examples of what I'm talking about are in your text. Pay attention to these confusing items and you'll be okay for the next exam.